Welcome to the Spartan Nurse Podcast. We're your hosts, Dr. Mike Martel
and Dr. Crista Reaves.
Today we are sitting down with Alexa Andersen, who you may not know, but I've had the pleasure of having Alexa in clinical. So tell us a little bit about yourself and, what led you to a career in nursing.
Yeah, thank you so much, Mike. It's so great to be here and see both of you. So it's really interesting how I came to be in nursing, because nursing for me is a second career. I wanted to go into higher education and student affairs because I really just valued being involved and taking on leadership roles. So that's what I decided to do. After I graduated, went to grad school down in Bowling Green in Ohio for their program. And what ended up happening when I was in school, it was just a 2-year program, but I ended up becoming very sick when I was in school. That experience, getting sick and what came afterwards, really has just shaped my life, because I spent many years dealing with those health issues, trying to figure out how to manage them. It really was the experiences I had, both positive and not so positive, as a patient that made me think, I think I might want to get back and do something actually in health and medicine. I shadowed some nurses, did some volunteering, and I realized I think it might be nursing.
Tell us a little bit about what you're doing now, currently.
Definitely. So after I graduated nursing school, I did work in Grand Rapids, that's where I live, for a federally qualified health center as a clinic nurse, did some care management type of work. I really just felt like, thinking about what I had been through personally, what I've seen with my friends, people I've met, I just felt like there was an opportunity there to maybe do something. And that was why I decided, I think research might be the path. And so that was why I decided to come back to the PhD program here at Michigan State. What I'm interested in really is, just to sum it up, is disability work. So disability work in the nursing field. Specifically, I'm interested in what you would call an invisible disability.
Okay.
And that's because that's what I have, is in the invisible, a number of invisible disabilities. And like I shared, people I've met, that's what they have. And I've just realized it's such an area that just isn't talked about a lot, but clearly a lot of people are dealing with these issues. So what I'm hoping and planning to do research on is emerging adults, which is essentially just young adult age, who have invisible disabilities, and pretty much just what their experiences are living with those invisible disabilities. So that's what I'm going to do right now in my PhD program, but also even just in the future, I hope to look a lot more at nurses themselves who have invisible disabilities, also nursing students who will eventually be nurses. So I think it's a really different kind of topic, when you think about disability, but it's also, I think it's everywhere, like in our field and just the world too. So yeah.
So can you define a little bit more about what an invisible disability is?
A disability is just any physical or mental condition that has a real profound effect on your life. So maybe affects your daily activities or movement, something like that. An invisible disability is any of those physical, mental conditions that affect your life that you just can't see from the outside. So someone might be diabetic, but when you look at them, you would probably most likely not know that they're diabetic. Now, they might have their monitor maybe on their arm, so maybe you might see that, which would be an indicator. But if you don't see that or know them or whatever, you wouldn't know. So diabetes could be considered an invisible disability. There's just so many different things, but just, it's essentially anything that you can't see from the outside.
And that's great that you're raising awareness for that too.
The difference between just a disability and an invisible disability is that maybe they're not sharing it or outwardly expressing it.
It could be
where they would be with because I'm thinking, what's the difference between if you had a mental disability?
Yes. I would definitely classify depression, anxiety, any mental health challenge that you might think of would essentially be invisible. This is right. You don't know that someone has that.
How many people do you feel like have an invisible disability?
So apparently, according to the World Health Organization, they believe that about 1.3 billion people in the world have a disability. Of that 1.3 billion, they believe 80% are invisible. So when you think about someone you might see who you believe has a disability, whatever it is that you see, you're only seeing 20% essentially of disability in the world. The area that I'm interested in is with emerging adults. So that is anyone whose ages 18 to 25. Ages 18 to 25 tends to be a very big transition period. Also, it can be a time, where you're developing relationships with others. And so
And independent
yes,
for the first
yeah,
time. And
all that stuff. So think about all the stuff that's going on anyway in your life. It's a lot. And then what if you throw in a disability? And a disability that someone can't see. So, I really like to share this example that you could think maybe someone has something, it could be like Crohn's disease, and you're in college and all your friends maybe that you just met are like, hey, let's go out to eat. But they're going to go to a restaurant that has food that maybe won't sit well with you, or you might cause issues. So maybe you say, oh, that's okay, I'll just pass. So you don't go. But then maybe the next time they ask, you pass again. Do people start wondering, well, why does Alexa keep missing it? What's going on? So that can cause a lot of extra feelings like anxiety, maybe depression, whatever it might be. But there's just so many different things going on. And this is just like that added thing that just creates like an extra barrier, I would say. Yeah.
right. Why is it important for nursing to study invisible disabilities?
Oh my gosh, I love that question, Crista. I feel like there's so much I could say too. So I think it's just very important because when you think about wherever you might be working, so if you go to the hospital, so a clinical setting like that, you're helping a patient with maybe they just had their gallbladder removed. So you're just taking care of them until they get out of the hospital. But do they have other conditions that they're dealing with as well? So maybe they have very severe anxiety that could be causing other issues while they're there in the hospital. So I just think as a nurse, it's just so important to be aware of this and also to have an understanding just of, well, what could this mean if someone is dealing with some kind of chronic condition that is very disabling?
And I think with the statistic that you provided with how many people are affected by these invisible disabilities, it's almost like nursing needs to treat everyone as if they might have an invisible disability. And then if they don't, then they don't. But you're still treating them holistically.
Yes.
As a complete person with all of the things that they have going on.
Yes.
Which really is like the core of nursing, right?
So how can nurses or nursing students with invisible disabilities maybe better navigate nursing school or the workplace, and what accommodations might be available to them?
Oh my, that's a great question, Mike. So the first thing that I think of really is, for example, here at Michigan State, we do have a very important resource. It's called the Resource Center for Persons with Disabilities. And many colleges and universities have some kind of center like this, but you can go there and you can get assigned an advisor depending on whatever conditions you might live with. They kind of sort you into different groups, and that advisor will sit with you for your initial meeting. I think it was at least an hour, and you just kind of talk about everything, what it is that you live with, what challenges you have. And then if you have suggestions, you can give those, but they'll also give suggestions for, what you might be able to do in terms of accommodations. So I think definitely starting there, wherever you might be in school, I think is a great place. What I would say a big piece would just be that communication with your advisor at the center, but also with your faculty member of the class, and just talking about like, what might we need to do? So for example, I don't mind sharing it all. When I was in nursing school, so one of the conditions I live with, sometimes I can have a very difficult time standing for long periods. And so I was worried in clinical, like, what am I going to do? But I had shared with faculty, throughout the program, like, hey, sometimes, I might just need a stool or a chair. So yeah, just really simple things like that.
Are there things that people shouldn't ask about your disability
Ooh.
or an invisible
That's a
disability?
good question.
Yes. Whatever it is you say, if it's making an assumption that you don't know, for sure.
That's what I was going to say.
Yes.
Maybe being judgmental.
Yes.
Nice.
Yeah, that's a good way.
Quick to judge
Yes.
without listening.
Yes. But otherwise, I really do think people, just want others to understand them better. I've lived with the different conditions I have. Everything kind of started in 2008. It's been a while now, and I still get nervous sometimes when I have to tell someone something. And I think what I'm nervous about is, do they believe me or are they judging me? And typically that does not happen, but I just think about that beforehand because I worry a lot and I'm a very anxious person.
Sharing that with somebody, it does make you vulnerable. What if that person judges me, or what if they, so I think, having that non-judgmental approach on the person that's helped supporting that person is so crucial. A lot of times when I would talk to patients in group therapy, they would say that the biggest thing that stressed them out is stigma.
Yes.
Because they were so worried about sharing what
Yeah.
was going on with them. So,
You just made me think too, Mike. I think this can be different for everyone, but for me, I've gotten to a point now with some of the conditions I live with, I almost feel like it's kind of like a superpower of mine. Maybe that's silly to say, but I say that because you are bringing a different perspective. And so I think a lot about, how does that influence nurses? How does that influence the program you're in, whatever it is.
sharing your story is great too, because, hopefully others, even some of our listeners that may be living with an invisible disability, it can empower them to,
Yes.
speak up, to advocate for themselves. And I think that that's great.
Right. Empowering them to feel comfortable speaking up. And then, right, who's that going to connect with? You'll start meeting other people and it just grows from there.
Right. Then they feel safe.
Yeah.
Is there anything else we haven't covered that maybe you want to add?
If anything, to really think about maybe how it is that you think of disability, to really kind of reflect on that. And then I think go from there. Maybe you could start reading about different things, talking with others, maybe talking with your family, friends. That reflection piece, I think, is really important for all of us to do. I think that might be really the big starting point. And that's kind of essentially, once you do that, that's what I think leads you to the understanding, the being more empathetic. So yeah, I think I would say that is kind of like the first thing.
Having the humility to know I can grow
Yeah.
and I can learn these other things and I can change my perspective. I can change the way that I view someone is really powerful.
On that learning, sometimes we would have patients in the ER, young pediatric patients, and they would maybe have a condition that I wasn't familiar with. I would ask the parents, I would say, can you teach me more about this? And I will tell you, it's so empowering. And they appreciated that so much because it's they would pull out sometimes a book to show me, what was going on with the patient. Sometimes it'd be medical, sometimes it'd be a mental health thing, but there might be conditions that you're not really familiar with, and you have to be open to learning those things. And I think as nurses, sometimes we trick ourselves into thinking that, we have to give that perception that we know everything, but there's always things that you can learn. There's always, opportunities for learning, and you want to be able to, ask people about what's going on with them and really dig in.
So where can people learn more about invisible disabilities?
Yes. Ooh, there are a lot of organizations out there. I think it is the Invisible Disability Association. It's like IDA. I think that's a real great one to start with. Something else I just thought of. So when you've been traveling recently in the airport, have you guys seen this image? It's a sunflower, hidden disability sunflower.
okay.
So what the point of it is they have created this icon, this image is just a sunflower on a green background. And it's supposed to indicate, hey, I have an invisible disability. So it could be like a badge that you wear. So the example I was sharing, it's at airports now. But you can get something that you can hold, you could take on the plane. So it's starting to pop up now here in America.
Awesome. We should encourage that here.
Honestly, Mike, I've had that thought and I was like, can I do this?
Yeah. I mean,
I don't know. Yeah.
It all starts, it starts with an idea and a vision and a passion. That's what it starts with. So, can you do this? Yes. Right?
Yes.
I would say yes, you can. I would go for it.
The only other thought I had in terms of resources would to just be, if you do find out about some condition, I would say many of them have organizations, here in America or around the world that you could look up. One of the ones I'm involved with, so I have what's a form of dysautonomia, and dysautonomia is just dysfunction of your nervous system. So the dysautonomia part, but there's dysautonomia.
Breaking it down.
Yeah.
Yeah.
I appreciate
Okay,
that.
I do too. Yep.
Yeah. But there's Dysautonomia International. It's a huge organization and they do tons of stuff. I've been involved with them for a number of years, so it's a very specific resource. But yeah, there's groups like that. And this one is worldwide, which is really neat because you can meet people, talk to people from all over the world. So there's a lot of things like that you can check out.
Well, thank you so much, Alexa, for joining us. To find your breaking news and latest updates within the College of Nursing, please refer to our website at nursing.msu.edu. You can also find us on all social media platforms at MICHST Nursing. Who will?
Spartan nurses will.